When patients come to us, a lot of them have lost part of the dental apparatus that supports their teeth. One thing that they lose is the bone that holds their teeth in. The bone can be replaced in many, many cases. What we're able to do is draw a little bit of the patient's blood, put it in a centrifuge to concentrate the platelet layer of the white cells, and we're able to draw that out and then use it to soak bone, to soak soft tissue, to increase and enhance the healing process and actually regrow the bone around their teeth. Another thing that we see a lot of patients present us with, long teeth. You heard the term, he's getting long in the tooth. Well, we're actually able to now bring that gum back down so when the patient smiles, they have a normal appearance to their teeth. We do that by utilizing alloderm, which is human skin that's been processed, basically connective tissue. We mix it with our platelet-rich plasma, and we're able to slide it under the gum and pull the gum down over it, and that covers their teeth up. It makes a big, huge aesthetic difference in patients. Plus, by doing that, we increase the longevity of their teeth. PRP makes it healing on all these techniques, bone grafts, soft tissue grafts, more predictable. It increases the healing time in people, and it really benefits the ultimate success of the procedure.